Hello, my name is Prajakta Yadav. I am a student of Decision Training Center. Today I am going to discuss a technical topic about endocrine disorders. So let's start with the topic. So the endocrine system is a network of glands that secrete hormones which regulate various psychological processes in the body. These glands include thyroid, adrenal gland, pituitary gland, pancreas, ovaries, and testes. Among others, hormones act as chemical messengers that influence growth, metabolism, mood, sexual function, and reproduction. When the endocrine system is disrupted, it can lead to a range of disorders. These disorders typically arise due to the overproduction or underproduction of hormones. These the resistance to their action or improper regulation of hormonal release. Types of endocrine disorders. Thyroid disorders. The thyroid is a butterfly shaped gland located at the base of the neck. It produces thyroid hormones T3 and T4 that regulate metabolism. Disorders of thyroid can include hypothyroidism. This condition occurs when the thyroid gland produces insufficient thyroid hormones. Symptoms include fatigue, weight gain, cold intolerance, depression, and constipation. The most common cause is autoimmune thyroiditis, known as Hashimoto's thyroiditis. Hypothyroidism. This is characterized by excessive production of thyroid hormones, often due to Graves' disease and autoimmune disease. Symptoms include weight loss, rapid heartbeat, anxiety, heat intolerance, and increased sweat. Goiter, an enlarged thyroid gland often associated with either hypothyroidism or hyperthyroidism that can result from iodine deficiency or autoimmune diseases. Thyroid cancer, a rare but serious disorder where cancerous cells develop in the thyroid. It may cause symptoms like neck lumps, difficulty swallowing, or hoarseness. Adrenal disorders. The adrenal gland sit atop the kidneys and produce hormones such as cortisol, aldosterone, and adrenaline. Adrenal disorders can affect stress responses, metabolism, and electrolyte balance. Cushing syndrome. This disorder occurs due to an overproduction of cortisol, which can result from adrenal tumors or prolonged use of corticosteroid medications. Symptoms include weight gain, high blood pressure, thinning skin, and easy bruising. Addison's disease, a condition where the adrenal glands do not produce enough cortisol and aldosterone. It can cause fatigue, muscle weakness, weight loss, low blood pressure, and darkening of skin. It is often caused by autoimmune damage to the adrenal glands. Adrenal insufficiency. When the adrenal glands do not produce adequate amounts of hormones, this can lead to symptoms similar to Addison's disease and can be life threatening if untreated. Pituitary disorders. The pituitary gland, often referred to as the master gland, regulate other endocrine glands through hormone secretion. Disorders in the pituitary can affect growth, reproduction, and metabolism. Pituitary tumors. Non-cancerous tumors of the pituitary gland can disrupt the production of hormones depending on which hormone is overproduced or underproduced. Symptoms may include infertility, acromegaly, excessive growth of bones and tissues, or diabetes insipidus. Growth hormone deficiency. Insufficient production of growth hormone in childhood can lead to sustained growth, while in adults it may cause a decrease in muscle mass, energy levels, and overall vitality. Hyperpro- Hyperprolactinemia. Excess production of prolactin can lead to menstrual disturbances in women, and galactorrhea, production of breast milk in non-lactating individuals. In men, it can cause erectile dysfunction and reduce libido. Pancreatic disorders. The pancreas produces insulin and glucagon, which regulate blood sugar levels. Disorders of the pancreas often result in problems with glucose metabolism. Diabetes mellitus. This is one of the most common endocrine disorder. It is classified into type 1 and type 2 diabetes. Type 1 diabetes, an autoimmune disorder where the immune system attacks insulin producing beta cells in the pancreas, leading to insulin deficiency. It usually develops in childhood or adolescence. Type 2 diabetes, a condition of insulin resistance where the body does not respond effectively to insulin. It is more common in adults and is often associated with obesity and lifestyle factors. Hypoglycemia, low blood sugar levels, which can occur due to excessive insulin or other medications. Alcohol consumption or prolonged fasting. Symptoms include dizziness, confusion, sweating, and more unconsciousness. Sexual and reproductive endocrine disorders. The ovaries in women and testes in produce sex hormones like estrogen, progesterone, and testosterone. Disorders in these glands can affect reproductive health and secondary sexual characteristics. Polycystic ovary syndrome (PCOS), a common condition in women of reproductive age characterized by irregular periods, excessive hair growth, acne, and ovarian cyst. It is linked to insulin resistance and can lead to infertility. Hypogonadism. This occurs when the gonads, ovaries, or testes do not produce sufficient levels of sex hormones. In women, it can lead to menstrual irregularities and infertility. In men, it may cause reduced libido, erectile dysfunction, and loss of muscle mass. Klinefelter syndrome, a genetic disorder in men where they have an extra X chromosome, leading to low testosterone levels, infertility, and sometimes learning difficulties or developmental delays. Endocrine disorders related to calcium and bone health. Calcium metabolism is regulated by hormones such as parathyroid hormone (PTH) and calcitonin and vitamin D. Disorders in these regulatory systems can lead to problems with bone density and calcium levels. Hyperparathyroidism. This occurs when the parathyroid gland secretes too much parathyroid hormone, leading to high levels of calcium in the blood. That is hypoglycemia. It can cause osteoporosis and kidney stones, fatigue, and abdominal pain. Hypoparathyroidism. Insufficient production of PTH results in low calcium levels, leading to symptoms like muscle cramps, tingling, or seizures. Causes of endocrine disorders. Endocrine disorders can be caused by a variety of factors, which includes genetics. Many endocrine disorders have a genetic basis. For example, type 1 diabetes is linked to a specific genetic markers, and Turner syndrome is a genetic condition that affects the development of the ovaries. Autoimmune diseases. The immune system can mistakenly attack the endocrine glands, as seen in Hashimoto's thyroiditis, hypothyroidism, and Addison's disease, adrenal insufficiency. Infections. Some infections can damage endocrine glands, leading to disorders. For instance, mumps can cause inflammation of the pancreas and affect insulin production. Tumors, both benign and malignant tumors, can affect hormone producing glands, disrupting their function. These tumors may be found in the pituitary, adrenal, thyroid, or pancreatic glands. Environmental factors. Exposure to certain chemicals, toxins, or endocrine disrupting substances can interfere with hormone regulation. Lifestyle factors. Poor diet, stress, lack of physical activity, and obesity can contribute to endocrine disorders, particularly in the case of diabetes, metabolic syndrome, and thyroid dysfunction. Diagnosis and treatment of endocrine disorders. Diagnosis. Diagnosis typically involves a combination of clinical evaluation, blood tests to measure hormone levels, imaging tests, example ultrasound, CT scan, MRI, and sometimes biopsy if a tumor is suspected. Blood tests. These are used to measure levels of hormones such as thyroid hormone, insulin, cortisol, etc., and markers of organ function, for example, kidney and liver function. Imaging test to identify tumors or gland enlargement. Genetic testing in cases of suspected genetic disorders. Treatment for endocrine disorders. The treatment of endocrine disorders depends on the specific condition but may include hormone replacement therapy. This is common in cases of hormone deficiencies such as thyroid hormone replacement for hypothyroidism or insulin for diabetes. Medications. Drugs may be used to control hormone overproduction. For example, antithyroid drugs for hyperthyroidism, corticosteroids for Addison's disease, or metformin for type 2 diabetes. Surgery. In some cases, surgery may be necessary to remove tumors or parts of glands, such as in the case of pituitary tumors or thyroid cancer. Lifestyle changes. Weight management, exercise, and a healthy diet are essential in managing disorders like type 2 diabetes, polycystic ovary syndrome, that is PCOS, and metabolic syndrome. Endocrine disorders are a diverse group of conditions that affect hormone production and regulation. They can have a wide ranging effects on the body, impacting everything from metabolism to reproductive disorders and preventing complications in many cases with proper management. And individuals can lead a healthy, normal lives despite having an endocrine condition. So today we discussed about all about the endocrine endocrine disorders and their treatment, diagnosis. Thank you for listening. Thank you again.